With a burst of executive orders, President Joe Biden served notice the nation's COVID-19 response is under new management, and he's demanding progress to reduce infections and lift the siege Americans have endured for nearly a year. He says he is going to, quote, manage the hell out of the pandemic. The 10 orders signed by the president are aimed at jumpstarting his national COVID-19 strategy to increase vaccinations and testing, lay the groundwork for reopening schools and businesses, and immediately increase the use of masks, including a requirement that Americans mask up for travel. One directive calls for addressing health care inequities in minority communities hard hit by the virus. Joining me on the morning show, David Johnson, a healthcare strategist with Foresight Health. Good morning, sir.
Good morning, Bruce.
This is an ambitious agenda, a lot to accomplish in a short 100 days. Without getting political, realistic to think significant progress can be made and get around the detours and potholes left by the previous administration's mishandling of the crisis? Because, frankly, words won't be enough.
Well, there's probably not a lot we can do about the first 100,000 deaths because there's a 30-day lag between infection and when deaths begin to occur. It's really the second 100,000 deaths that the president's program's focused on, and there is a lot we can do to help reduce that number.
Joe Biden called this a wartime undertaking. We have been told the darkest days lie ahead, and the number was just revised. There may be another 169,000 deaths by mid-February. Can this action mitigate that?
Well, as I was saying in a few moments ago, it's probably not going to mitigate that $169,000 number. Thank you for the new number. It's really the deaths after that we're focused on right now, because there is this lag between infection and when deaths begin to happen.
We know there aren't enough vaccines available. Johnson & Johnson, AstraZeneca may come online sometime in the near future. But sources say the president is inheriting a non-existent vaccine distribution program and has to basically start from scratch. Is it possible to turn things around and turn them around quickly?
Oh, yes. More manufacturing, better supply chain, more vaccine administration sites, more vaccine administrators. That's how we're going to get 100 million shots in the arms in the next 100 days. Now, interestingly, Bruce, on the vaccine front, America will go from a vaccine shortage position to a vaccine surplus position over the next several months, particularly once the AstraZeneca and Johnson & Johnson vaccines come online. So that's why it's so important now to get the vaccine sites increased and the number of vaccine administrators increased.
You know, now that there's a new administration, Dr. Birx has been very forthcoming, and she said that she heard within the administration that there were people who said that it was a hoax. Dr. Fauci said that he was tethered from talking to the media. And he's also saying now that, look, we can talk about science, encouraging for you to hear that science and not politics will dictate the way forward.
Oh, absolutely. No more hydroxychloroquine.
So the president's adopting a two-pronged message, warning that the season of death and sickness is going to intensify, which you alluded to, while offering an optimistic prediction that the horror won't last forever. If you had the president's ear right now, what would you tell him?
More of the same, full speed ahead on both the vaccine and the public health fronts. The second thing I'd say is that results aren't enough. You also have to win the hearts and minds of the people that are reluctant to take the vaccines. That means getting inside their heads, understanding what's motivating them, and really beginning to work on changing those pictures. So both hearts and minds, as well as getting results.
David Johnson, appreciate your insights. Thanks for joining us. Have a great day.
Thank you.